The ASPEN trial is a phase 3 randomized trial of two BTK inhibitors, Zanubrutinib versus Ibrutinib for patients with Waldenström's macroglobulinemia. In this study, patients were eligible if they had a histologic diagnosis of Waldenström's macroglobulinemia. They had a mid MYD88 mutation, and also they required treatment. Both previously treated and previously untreated patients were eligible to be randomized in this study, which included 201 patients. The primary endpoint of the study was very good partial response or better. And what this study showed is that there was a superiority in the very good partial response or better in patients treated with Zanubrutinib. But this difference was not statistically significant. Thus, treatment with Zanubrutinib resulted in a higher response rate, which was not statistically significantly different from Ibrutinib. However, what was observed in this study is that the safety and the tolerability was in favor of Zanubrutinib. For example, adverse events leading to treatment discontinuation or death were observed in 9% of patients treated with Zanubrutinib versus 4% of patients treated with Zanubrutinib. And also, there were fewer episodes of atrial fibrillation, which we know is a well-established complication of Ibrutinib, but this incidence was lower in patients treated with Zanubrutinib. The same applied for hypertension, whereas there was more neutropenia in the Zanubrutinib arm, however, without a difference in the infections. The progression-free survival of the patients with the follow-up that we have in the study was similar. To conclude, Zanubrutinib was associated with a very good partial response or better of 28% versus 19% with Zanubrutinib. This difference was not statistically significant, but Zanubrutinib demonstrated a clinically meaningful advantage in the safety and tolerability.